Hey everyone, and welcome back. We're diving into something super important for any nursing student out there, providing culturally respectful care.
Yeah.
It's a big one, and we've got all your materials right here, ready to break down the key takeaways to help you really excel in your future careers.
It's not just about being a good nurse. It's about being fantastic no matter who your patient is, and that all begins with understanding how much culture plays a role in a person's healthcare experience. Think about it. Culture shapes like everything from how we see illness and wellness to what treatments we prefer and even how we experience pain.
That is such a good point. It's so easy to forget that, even something like a broken bone could mean something completely different to someone, let's say, from a culture that relies a lot on traditional healing, compared to someone who, grew up in a family that's all about Western medicine.
Right.
And the materials you gave me actually illustrate this perfectly with that story of Danielle, the Haitian immigrant who broke her femur.
Right. Danielle's story really shows how cultural sensitivity isn't just some theoretical thing. It has real consequences for how we care for patients. In her case, she really wanted to have a traditional Haitian folk healer as part of her treatment along with the doctors. So how would you, as a future nurse, handle that? How would you balance respecting Danielle's beliefs while making sure she's getting, the best care possible?
That's a really good question. It's almost like you're walking a tightrope, isn't it? You want to honor what the patient believes, but also make sure they're getting the most effective treatment.
Exactly.
And the materials you shared actually lay out some key terms that every nursing student should really understand.
Yeah.
Things like cultural assimilation, culture shock, stereotyping, both the positive and negative kinds, cultural imposition, and cultural blindness.
For sure.
These are terms we hear all the time, but it's easy to mix them up.
Absolutely. So let's start with cultural assimilation. It's, often described as a process where people adopt traits of a new dominant culture, but it's not as simple as just dropping one culture and taking up another. It's way more nuanced than that. Imagine a family with multiple generations. The grandparents are recent immigrants. The parents grew up kind of balancing two cultures, and the kids are totally immersed in the dominant culture. How might all those levels of cultural assimilation affect their healthcare choices and how they interact with providers?
That's a great point. I never thought of it that way. You're right. It's definitely not a one-size-fits-all thing. And speaking of feeling out of place, the idea of culture shock is something I think we can all relate to, whether we've traveled to a new country or even just been in a new environment. Those feelings of disorientation and discomfort can be really intense.
Oh, yeah, for sure. Now, let's get to stereotyping. We all know how dangerous negative stereotyping is, right? Giving negative traits to a whole group of people. It's the root of prejudice and discrimination, and it has no place in healthcare. But what's interesting is that even positive stereotyping can be a problem. Praising a patient for being so articulate or assuming they're, good at math just because of their race can feel patronizing and ignores that everyone's an individual.
It's like we're putting people into these neat little boxes based on their culture, and that can be really harmful. It's so important to remember that everyone is unique, and we need to approach each patient with a fresh perspective without preconceived notions. Now, what about cultural imposition and cultural blindness? How do those concepts play out in a healthcare setting?
So cultural imposition is basically when we push our own beliefs and values on other people. It can happen in subtle ways, like assuming all patients want to be called by their first name, or more obviously, dismissing a patient's traditional healing methods as, superstitious. And cultural blindness is the flip side. It's ignoring those cultural differences completely and treating everyone as if they all have the same beliefs and practices.
So cultural imposition is like saying my way is the only way, and cultural blindness is saying there's only one way. Neither of those are helpful or respectful.
Exactly. Think about it this way. Imagine a situation where a Muslim man, let's say his name is Khalifa, brings his wife to the hospital. Because of his faith, he asks that only female healthcare providers care for his wife. This actually happened, and it caused a bit of a stir because the nurse on duty wasn't ready for that kind of request. She ended up scrambling to find the hospital policy and probably felt a bit lost at that moment.
That's a perfect example of how not being prepared for these kinds of cultural differences can lead to confusion and maybe even cause harm. It really reminds us that as nurses, we need to always be learning and expanding our understanding of different cultures.
It really emphasizes how important cultural humility is. It's not just about knowing facts about other cultures, but approaching each patient genuinely wanting to understand their perspective and recognizing that our own cultural lens might be different from theirs.
And that brings us to the very practical challenge of language barriers.
Oh, for sure.
I mean, it's already hard enough to explain medical procedures and treatments when everyone speaks the same language.
Yeah.
But when you add in a language difference, it can become incredibly difficult to make sure patients truly understand what's happening and feel comfortable, asking questions.
Absolutely, and that's why the story of A. Kelly Gaylor, a nursing student who used her Spanish skills to comfort a terrified couple who didn't speak English, really resonated with me. She didn't have to be fluent to make a difference. Just having those basic Spanish skills and the empathy to use them helped bridge that communication gap and build trust.
That's so inspiring. It's a good reminder that even small things can make a huge impact. We don't need to be experts in every language to connect with our patients.
Exactly. It's about being willing to step outside of our comfort zones and meet our patients where they are.
Now, the materials you shared also brought up this really helpful tool called the ESFT model, which seems like a great way to make sure we're truly understanding a patient's perspective on their own health. Can you tell us more about that?
Yeah, ESFT stands for explanatory model, social and environmental factors, fears and concerns, and therapeutic contracting. It's a framework for having those culturally sensitive medical interviews that we talked about.
Okay, so instead of just jumping right into a list of symptoms and medical history, you're really taking the time to listen to how the patient understands their own illness.
Right. You start by asking these open-ended questions like, what do you think caused this? Or what are you worried about with this diagnosis? That way you're letting them share their viewpoint, which might be based on cultural beliefs that are, different from your own. Then you think about their social and environmental situation, things like, can they even get to their appointments? Or do they have enough to eat? These things can have a huge impact on whether they get better.
And the T in ESFT is for therapeutic contracting, right? So it's about making sure the patient is really a partner in their own care.
Exactly. It's about working together with the patient to make a treatment plan that they understand, agree with, and feel good about following.
This ESFT model seems so helpful. It reminds us that good communication isn't just about giving medical facts. It's about building trust and understanding. And speaking of tools, the materials you shared also mentioned some really useful transcultural assessment guides.
Yes, tools like the Andrews et al. Transcultural Nursing Assessment Guide and the Geiger and David Heiser Transcultural Assessment Model can be super helpful for nursing students. They give you structured ways to gather information about a patient's cultural background and make sure you're asking the right questions.
So instead of just focusing on the physical symptoms, these guides make you think about things like what the patient believes causes illness, their dietary habits, their family dynamics, and a lot more.
Exactly. For example, they might ask, why does the patient think they got sick? Or what name do they give to their condition?
Those are such important questions. It's like having a map to help you understand your patient's cultural world and provide truly personalized care.
Precisely. Remember, every patient comes in with their own set of values, beliefs, and experiences. Transcultural assessments help us honor that and adjust our care to fit them.
Now, kind of switching gears a bit, the materials also touch on something a little heavier, health disparities. The fact that some groups of people don't have the same health outcomes because of things like race, socioeconomic status, even where they live.
It's a tough reality that we as nurses have to be really aware of. It's not enough to just treat what we see in front of us. We need to be advocates for social justice and work to get rid of these disparities. Think about the communities you've seen or lived in. Have you noticed any patterns in who seems to have better access to healthcare, healthier food, or safer neighborhoods?
That's such a crucial point. We need to understand those bigger issues that contribute to health disparities and use our voices to push for change.
Absolutely. Now let's talk about something more practical. The real challenge of taking care of someone when you don't speak the same language.
Right. I mean, it's hard enough to explain medical stuff in plain English, let alone when you're trying to talk to someone who speaks a whole different language.
Exactly, and that's why that story of A. Kelly Gaylor, the nursing student who used her basic Spanish to help a non-English speaking couple in labor, is so impactful. It really shows how important linguistic competence is, not just for healthcare providers, but for the entire healthcare system.
That story really highlights the need for things like qualified interpreters, translated materials for patients, even having staff who speak multiple languages.
Think about it from the patient's perspective. If you were scared, in pain, and couldn't understand what was going on, Wouldn't you feel so much better if someone could talk to you in your own language?
Absolutely. It's about creating a healthcare environment where everyone feels welcome, safe, and understood. And that brings us back to the importance of cultural humility. It's realizing that we don't know everything and that our patients are often the experts on their own culture.
Exactly.
It's being open to learning from our patients and being ready to adjust our care to fit their needs. So it's not just about memorizing facts about different cultures. It's about approaching each patient with real curiosity and respect.
And remembering that culture is always changing. What might be okay today might be different tomorrow.
That's a really good point. It's a constant learning experience.
Exactly. And that's why self-reflection is so important. We need to be looking at our own biases and assumptions all the time and be open to changing our mind.
And be willing to have those sometimes uncomfortable conversations about race, ethnicity, and culture.
Absolutely. Because in the end, our goal as nurses is to give the best care to everyone. And that starts with understanding and respecting their cultural backgrounds.
You know, one thing that really jumped out at me in the materials was the part about physiological differences between cultural groups.
Yeah.
It's fascinating to think about how our genes can affect our chances of getting certain diseases.
Well, research has shown that some racial and ethnic groups are more likely to have specific conditions. Like sickle cell anemia is more common in people of African descent, while Tay-Sachs disease is more common in people of Eastern European Jewish descent.
That's really important information for nurses to know. It can help us spot potential risks and tailor our assessments.
Mhm.
But I imagine there's also a risk of falling into the trap of stereotyping, right?
You're absolutely right. We have to remember that these are just trends. We can't assume everyone in a particular group will get a specific disease. We always need to see each patient as an individual, considering their family history, lifestyle, and what they believe about health.
So it's about using this knowledge to inform our care, but not to, define it.
Exactly. We need to be careful about bias and always put individual care first.
Now, another area where cultural sensitivity is super important is in how we assess and manage pain.
Mm-hmm.
The materials really emphasized how cultural beliefs can shape how people feel, experience, and even express pain.
That's so true. Some cultures encourage stoicism. They think showing pain is a sign of weakness. Others might be more expressive and see pain as something you should talk about openly and deal with.
So a patient from a stoic culture might downplay their pain or not want pain meds, while a patient from a more expressive culture might be very vocal about their discomfort.
Yeah.
So how do we as nurses handle those differences and make sure everyone is getting enough pain relief?
It's about being really observant and asking the right questions. We can't just rely on what people say about their pain. We need to look at their facial expressions, body language, and changes in their vital signs. And we need to be mindful of how we talk to them, making them feel safe to express their discomfort in whatever way they feel comfortable.
And advocate for them to get enough pain relief, even if they're hesitant to ask for it.
Absolutely. It's our duty to make sure all our patients are comfortable and their pain is managed well, regardless of how they show it. Now, the materials also mentioned how cultural beliefs can affect how people view mental health and what they think is the right treatment. It's a topic that can be really sensitive, isn't it?
Oh, it can be really sensitive. You know, in some cultures, mental illness is seen as a stigma, a sign of weakness, even possession, while other cultures might be more open to getting professional help.
It makes you think about how we need to approach these conversations with a lot of empathy and without judging. We can't just assume everyone sees mental health the same way we do.
Exactly. It's about making a safe space, a supportive environment where patients feel comfortable sharing their concerns, their beliefs, without being judged, right? And it's about knowing what resources are available in our communities to help patients from different backgrounds who are dealing with mental health issues.
Sounds like active listening and asking open-ended questions are super important here. Oh, absolutely. And don't underestimate just acknowledging how a patient feels and validating their experiences.
Now, the materials also pointed out how cultural differences can affect how families are involved in the healing process.
Yeah, family dynamics are huge in healthcare. In some cultures, family members are expected to be very hands-on, making decisions and providing direct support. In others, there might be more emphasis on the individual's independence and privacy.
So how do we, as nurses, handle that? Do we always include the family in every conversation?
It's about finding that balance. We need to respect the patient's wishes about family involvement. Start by asking the patient who they want there and how much they want to share.
And be aware that how decisions are made can be different across cultures. In some, the oldest male might be the main decision maker. In others, it might be more of a group thing.
Right. It's about avoiding assumptions and really understanding each patient's unique family structure and how they communicate. We also need to consider how things like socioeconomic factors affect health and access to care.
The materials you gave me really highlighted how poverty can create its own set of cultural norms and challenges, didn't they?
They did. Poverty often traps people in a cycle of bad health outcomes because they can't get good food, safe housing, or decent health care. People living in poverty are dealing with a lot of stress, things like money problems, not having enough to eat, and being exposed to violence, which can seriously affect both their physical and mental health.
It reminds us that as nurses, we have to understand these social determinants of health and fight for policies and programs that fix these systemic inequalities.
We also need to treat all of our patients with dignity and respect, no matter how much money they have. Everyone deserves good health care.
Now, we've talked about assessments throughout this deep dive, but can we go back to that for a minute? The materials had some great advice for doing culturally sensitive assessments.
Oh, yeah. One key thing to remember is always ask the patient how they want to be treated, based on their own beliefs and values. Simple, but powerful.
It's about making the patient the center of their care, realizing they're the expert on their own culture.
Another tip is to pay attention to how we communicate. Use clear, simple language, avoid medical jargon, and always check if they understand.
And if there's a language barrier, we need to use qualified interpreters to make sure we're communicating accurately and effectively.
Don't forget to be respectful of nonverbal cues like eye contact, touch, and personal space. These can be totally different across cultures.
The materials also said it's important to get the patient's family involved in the assessment, as much as the patient is okay with, right?
Exactly. Family can give us valuable information about the patient's culture, health practices, and who they rely on for support. They can also be key in helping the patient understand and follow treatment.
Now, we all know education is a big part of nursing care. The materials talked about how we need to tailor our teaching to the patient's cultural background.
Oh, for sure. We need to be aware of cultural beliefs about health and sickness, what they eat, and how they like to learn.
Like if a patient can't read well, or comes from a culture where they learn best visually, we might need to use more pictures and diagrams in our teaching.
And we have to be mindful of cultural norms about modesty and touch. For example, if a patient isn't comfortable with a male nurse providing personal care, we need to respect that and find a female nurse to help them.
So much of this is about providing care that's personalized, respectful, and fits their culture. And, of course, advocacy is another important piece of culturally respectful care.
Absolutely. We have to stand up for our patients' cultural needs within the healthcare system.
And recognize any biases or systemic barriers that might stop our patients from getting equal care. We have to speak up for them.
That might mean challenging discriminatory practices, fighting for language services, or connecting patients with resources in the community that fit their culture. It's about using our voices and our knowledge to make healthcare fairer for everyone.
The materials we went over today really pushed us to look at our own cultural biases and assumptions.
It's a process of continually looking inward and seeing how our own backgrounds shape how we see things and how that might affect our interactions with patients from different cultures.
And it's important to remember that culture isn't set in stone. It's always changing, and how we understand different cultures needs to change too. So much of this comes down to being proactive, curious, and dedicated to providing care that's truly focused on the patient and respectful of their culture.
Well said. Every patient deserves to feel seen, heard, and understood, no matter their background.
That's a perfect way to wrap things up. Thanks for joining us for this deep dive. We hope this conversation has given you some valuable insights to take with you as you continue on your path to becoming culturally competent nurses.